Okay, everybody, welcome to yet another Ankota Healthcare Delivery Management Care Transitions Best Practice webinar. My name is Jeremy Jed Hamill. I am the Marketing Director here at Ankota, and I've had a great time each month learning more and meeting new people, and this month is no different. I'm very excited to introduce and to talk about our latest presenter. And bear with me as I go. So just to give you a little something about what the goal of this webinar is, it's pretty simple. We want to create a forum for care providers to share best practices in managing care transitions. And as you know, as a lot of you know, I should say, webinars are held the third Wednesday of each month at noon Eastern and 9 Pacific. So the goal of this, as it's stated, is to make sure that we are sharing ideas, sharing best practices, sharing enthusiasm, and finding ways to improve healthcare. Just to give you a sense, as usual, it's going to be a pretty quick hour. The agenda is pretty simple. We're currently in the welcome phase. Shortly, I will introduce the guest speaker. Then I will hand off the controls of the webinar to our guest speaker. That takes a little bit of time, or a few moments of adjusting from the control for the webinar to the guest speaker, so just bear that in mind. She will present. Then right after her presentation, we'll talk a little bit about what Ankota does. And in that time, we found that the best reason for that sponsor break is that it gives people who are listening an opportunity to formulate and to type up questions. And I say this a lot, but I've been to webinars myself where I've had really sort of pertinent questions I felt, but I just wasn't able to type them out in the time that they needed me to ask them. So we try to give people a chance to really think about what they want to ask. So after that sponsor break, we'll have a Q&A session with our speaker. Then we'll say thank you, and we will go about our day. So again, for the first time, I want to introduce today's guest speaker, who is Shereese Maynard Tucker. She is Shereese Maynard Tucker, MS, CEO of Envision Care Strategies. She is all over the healthcare space, not just being a consultant and a fantastic speaker, as you will soon see. She's a blogger, content marketing strategist. She's got experience all across the board. And I'm excited because I knew her before I met her through the internet, because she's also very supportive of those in this space, and is a very she's a cheerleader for this, for managing care transitions and for improving healthcare. So I'm very excited to introduce her. And so without any further ado, I can hand over the controls to you, Sherry, if you are prepared. Are you ready to go for it?
I believe I am.
Okay. Okay, let's do this.
Now, is everyone able to see it?
Yes, I can see it. I think you're ready to take it away.
Okay. Thanks, Jeremy. Thanks, actually, for that lovely introduction. So let's give it a start, shall we? Today I'm going to present to you guys regarding evidence-based care transitions, the home health model. I am the CEO of Envision Care, as Jeremy said. So without further ado, we're going to move into our first slide. Now, sometimes people get confused with the definition of care transitions, but care transitions, or the movement of patients from one healthcare environment to another, has long been thought of as a hospital-based focus. Historically, home health was left out of the care transitions equation, and as accountable care organizations emerged, basically they were designed the same way. However, what we're finding nowadays is that these organizations and the hospitals and stuff really can't function or ensure that readmissions don't occur without including the home health as part of their plan to provide care. So now is a great time to have these type of partnerships with hospitals and accountable care organizations for providers, small providers, large providers, because it's needed. And it's needed to kind of complete the circle of care for patients and ensure that these patients are not being readmitted to the hospital. Now, one little model I designed years ago when working with the pediatric population was a circle of care. And the theory behind that is that you have to make the patient the center of everything you do, be it the hospital, the home health provider, case managers, the utilization review team, whoever it is. So if you build that circle of care around the patient where everybody is communicating and sharing information, the patient will make contributable goals towards their health, and also they will have a better quality of life. And the greatest benefit of that is that we keep them out of the hospital. Now, there are multi-disciplines that need to coordinate the care of patients, as we know. Now, some of them include things like OT, PT, mental health, the case management, of course. Some of them include a social services agent, or definitely home health and the primary care physicians. But they also have other specialties involved in their care. It might be a podiatrist and that type of thing. But all these people need to be able to coordinate care for that one individual. Where problems tend to come in is the lack of communication, no one sharing the data on the patient, and the patient loses control over their own healthcare data and what's being done to them. So you can imagine how this can cause problems in the home health environment if you have all these different disciplines, you know, prescribing stuff and scheduling stuff and that type of thing. It takes away the control from the empowerment from the patient. And we definitely don't want that. So how will these disciplines be able to co-coordinate care? Well, let's look at what they share. First, of course, they share the patient. That's the center of our circle. They all have time-sensitive goals. These can be as little as only annually, but a lot of them are time-sensitive goals that are monthly or weekly and sometimes even daily. So that's what we all share as providers. And reimbursement priorities. All providers in the system have those priorities that they share with each other. Nobody wants to be denied a claim. Reduce readmissions. Of course, that is all about focus here. So that's something we share. And efficacy-based priorities, meaning we need to be able to prove that our systems independently are working. And then we need to be able to track the model of care that we're giving to this client. Can it be traced so that we can prove that we're functioning properly for all entities involved in our delivery of care? Now, how does home health fit into all this? Well, home health, while sharing priorities, can't always benefit from the resources available to other types of providers. Well, let's size it up. Home health and private duty wear a lot of hats. So it can be difficult for them initially to obtain patient data. And we've all experienced that where you can't get the proper orders from the hospital or nursing home or whatever when a patient is discharged, and you need those final orders, and you need to make sure everything in them is correct before you can start servicing a patient. Multiple in-house priorities make coordination difficult, meaning you're dealing with scheduling, case management, a lot of paperwork, running an agency, and different things like that. But then also we're trying to control costs as providers, because our budgets are definitely a lot tighter than a large hospital. We need to be careful about every dollar we're spending, and where a lot of home health providers don't look at costs is where what they're spending per patient to manage their care. And a lot of those costs are out of control because of the lack of data being shared amongst providers. Now, other providers have the benefit of patient data readily available because a lot of them construct it. The physician does his own orders. The case manager makes the care plan. And so this stuff is readily available to them where we have to seek it out. And costs are usually contained because they're not done by the individual, they're done by the organization. And where do these priorities meet? If all of these persons involved in this circle of care need to coordinate the care for this patient, how can we all do that? And nowadays, and admittedly, home health and private duty have been a little slow to the party on this particular point, but technology is a place where we can all collectively meet and ensure that a patient, all their data and all the information concerning the patient is not only available to all of us in that circle, but also to the patient so that they have greater control over what type of information is out there about their care. Care transition technologies allow all providers to efficiently coordinate care to include home health. Not just the physician, not just the case managers, but the home health provider as well. How do we accomplish this? Well, we're looking to solve some problems with this. Good care transition programs are intuitive. They learn from provider activities. So if there's these disciplines involved in care, your programs should be able to predict certain outcomes and that type of thing and see problems before they arise. They also offer mobile and real-time solutions, which ensures the most up-to-date data available, which is what we all need, and then make it available also to the patient. This data is then able to be shared with other members of the care circles. How great would it be if one provider who's prescribing a medication and another provider who's prescribing a medication on the same day or a different day that's close by, if right away there's a flag saying, hey, we believe they might be allergic to this based on what this provider did, and everyone's able to share that information and avoid that problem for the patient. Now, what should the provider, the home health provider or the private duty provider consider when shopping for care transition adoption program? There are some questions you need to ask. First, does it allow scheduling and billing coordination? I get this question all the time because a lot of providers are looking for programs now as they look to be compliant with certain insurance companies' guidelines and Medicaid, Medicare, things that are going on in different states. They want to know if the scheduling and billing will work to their needs and also from a compliance standpoint. Two, does it allow staff to relay data remotely and through mobile use? This is very important. You have to look at things like can a care manager or the RN supervisor transmit data while on grounds with the patient? Will it work with all payment types, public and private? Huge issue nowadays. Everybody has their own set of rules. One of the issues with the Affordable Care Act was they allowed the states to expand their Medicaid programs, and when they put the exchanges and stuff in place, some of the things aren't working with other things, and that's why we see some of these issues coming up. Is it a learning program? Is it going to learn from what the data we're putting in to help us care for this patient? Is it interoperable? If your system is not working to get data where it needs to be, or another person in that circle of care's system is not working to get the data where it needs to be, it's not going to be comprehensive coordination of care. The 3 C's. Is it predictive? Identifying possible emerging health problems through clinical patient engagement. Very important. Is it economically feasible for the provider? There are a lot of care transition programs out here. You really need to look for one that works with your budget. It doesn't do you any good if the program you're using is putting you out of business. So you need to shop around for something that's going to work for your budget but give you exactly what you need. There are some other considerations. Will other providers in the circle of care adapt to the selected technology, or do they have a program that will be interoperable with your own? This is a question you want to ask before you adopt a system. You want to see if you're working with, if you're joining an ACO, or if you're working with a physician or the case management. If you're using the most updated technology, just ask them. Some systems will come up that they won't work with certain types of relay of data and that type of thing. So you need to ask those questions up front. Now, some systems can be, as I call it, tweaked to work with other systems or updated to work with other systems. What I find more nowadays is that some systems are too old. So some providers need to update what they're working with, or some care transition providers even have gone out of business, and you have providers out here still using their software and their programs, and that doesn't work. Okay, will staff have to be outfitted with mobile devices, or will the provider require staff to carry smartphones? if you're using home health aides and that type of thing, this is a great consideration because everybody doesn't, we like to think that they do, but everybody does not own a smartphone. So you need to be careful. If you're adopting a care transitions program, what types of devices do you need? What types do you need to purchase? And what would be required of your staff? And it's very important. A lot of programs now are telephony or location-based technologies. So you want to make sure that if you're hiring staff, that they can actually use the system. How will you ensure HIPAA compliance? Of course, none of us wants those fines. So you want to make sure that your system, if you're transporting data from one place to another, that it's HIPAA compliant under the current standards. Do you have a point person by the care transitions provider who will train and address concerns? One issue when you're adopting a new program, and this is true across the board, even if you look at, like I said, some of the healthcare things that they're putting into the states and that type of thing, you have to train the people who are already there. It does you no good to have a new system if nobody knows how to work it. So when you're looking for care transitions program, you want to ensure that you ask, how will we be trained, how often, and who's the point person to contact to make sure this gets done and that all our questions are answered. Now, what outcomes should you expect once you have this great new system in place and everybody's using it? Definitely, you should see marked reduced readmissions. That's the #1 thing that comes out of adopting a technological solution for your business. If you're not reducing readmissions, you really need to look at what is going on there. But it should be the #1 outcome that you see. Greater communications with other circle of care providers. Definitely something we can agree we all need. Better accessibility to updated patient data. How wonderful is that to be able to see a nursing care note or a physician's order in real time and immediately, as opposed to waiting for a physician to sign an order within 7 days. Better scheduling ability. Now, scheduling is one of those things. If you're a provider who runs into scheduling problems, and if you're working with aides, a lot of times that is an issue that I get asked about. When you adopt a system that works with scheduling, it cuts down on a lot of that because it allows you to predict where people are who can cover shifts for you. And the other thing, from a compliance side, if you're making that attempt to cover a shift and you can show you made an attempt, that is one of those things that will act as a defense if ever you're called to carpet by an accrediting body or a regulating agency. Keep that in mind. Streamlined agency management. How wonderful is that? Everybody's able to work within the system and keep everything up to date as it should be. Increased compensation when you send out your billing and everything is right in the billing. You don't have to worry about those claims being kicked back. And, of course, greater patient outcome. We'd all like our patients to feel better and get better, but we want to be able to show that they have made strides and are accomplishing goals. Now, where does an agency begin to find a good program? The most effective way to ensure proper agency care training by hiring a consultant. This is not me making a plug. This is 100% the truth. Agencies do not have time to look at every single program that's out there. You need to work with someone who can get you to where you want to go for your system, for your agency. So it's almost better to hire a consultant because you're saving time and money in doing it that way. Secondly, you need to set a budget for adoption. Most agencies I find are a little skittish in the area. You've mentioned budgets and they're like, oh, what's that? But you really do need to have a budget for updating technologies within your agency if you're going to stay A, compliant, but B, also be relevant in this field where people are actually referring patients to you. So you need to set a budget for that annually. 3, select a care transition program. Once you've decided and work with your consultant to pick a program, select it, get it in place. Don't put it off, oh, we'll do it in 6 months, we'll do it in a year. Get that program in place. And then make sure you and your staff get definitely training for the program so you feel good about moving forward. Then once you have done all that, the training's in place, you're set up, you're working the system, everything's wonderful, evaluate the program at least annually. You want to take a look at, first and foremost, patient satisfaction. Are your patients receiving greater care or at the right time, by the right people? Is it generating revenue for you? And is care coordination a smoother process for the agency? Those are the questions you should be asking once you've adopted a program. And where can you find more information on care transitions technology for home health and private duty? You can definitely check out Ankota. They have the greatest blog. They have a blog where it's different specialties all the time and lovely little tidbits. But there's also, if you look on the screen, there's a YouTube link to explain some of the care transitions information on YouTube. And then, of course, you can always talk to me. I love discussing things on LinkedIn because it's the most interesting people, as Jeremy said, where you can get up-to-date information and share industry data where, we can all make things better. So make sure you guys do that. And if you need to contact me directly, Jeremy can tell you how to do that. So that's my presentation. I hope you guys enjoyed it. Jeremy, I certainly hope you enjoy it, and I'm ready to give it back to you.
Okay, thank you. That was wonderful. Yeah, I'm going to bring it back to myself. Bear with me as I do some interneting. Let's see here. We're going to show my screen, and we're going to go full screen. Yeah, sure. Shereese, that was amazing. That was great. I'm always impressed by our guest speakers, but I'm always surprised at how good each one is from the last. So, I always learn something new. You're definitely a dynamic speaker, so I really do appreciate you taking the time. And like I said, I always learn something, so hopefully everyone else did too. I'm sure they did. So again, thank you so much. So we're going to take a little sponsor break. And again, to all our viewers and listeners out there, this is your opportunity to ask questions of Shereese. Anything, about the presentation or kind of in the care transition space are welcome. And so I'm just going to give you a little bit of time with that as I talk a little bit about what we do here at Ankota and so on and so forth. So first off, as you know, we're very passionate about the healthcare space and the care transition space and aging in place and all those types of areas. So if you are interested in presenting a webinar just like this one, please let us know. You can email me at jeremy.hamel@ankota.com or just go to our website. There's a fancy little contact box there. Makes it real simple, but definitely reach out to us if you're interested because we are very much passionate about sharing ideas, making not just good business choices, but good for the economy and good for obviously the people who we are in and are needing care or are needing the help that they're getting from private duty. So our next webinar will be Wednesday, August 12th. I'm sorry, actually be August 20th, I believe. It's the third Wednesday in August. It'll be 12 Eastern, 9 Pacific. And also, if you are interested in learning more about how to make or increase profitability via care transitions, we do have a white paper, a real simple kind of document that kind of outlines what you can do to kind of get into the space. You can find that at ankota.com/care-transitions. And there's a simple, downloading option and just a nice little informational piece to add to your repertoire. In terms of what Ankota does, obviously we are passionate about improving healthcare, but we are a transition software company. Our software does a lot of stuff that Shereese outlined. It accepts referrals from hospitals. We assign care transition coach, schedule an episode. It takes care of care and transition documentation based on NTOC best practices. And if you're not familiar with NTOC, you should check them out. They're a good trade organization, again, with the same concept of sharing ideas and improving the cause or improving conditions in healthcare. Again, so it runs on an iPad or PC, so you don't need an internet connection at home. It includes billing and payroll calculation. It's fully HIPAA compliant. It's visibility to all the, the organizations and the stakeholders that, we talked about, from hospital, the care team to the PCP. So if you are interested in those things, please let us know. We are happy to talk to you if you have any questions, or if you're interested in our products, or if you have any ideas for us. We're always well open to them. So with that, let's see if we have any questions. Let's see. Well, we do have a few, it looks like, and I'll just dive right into them. So to start, the first question is, how can a home, and this is for Shereese, of course, how can a home health entity begin working with an ACO?
Now, ACOs originally weren't open to the idea of home health. They thought, kind of the theory was that they had their own little providers out in the community and that type of thing. What some of them are doing now is launching their own home health entities, which is good for them and bad for them. So what I've been encouraging providers to do is to reach out to these organizations, and you can start by looking at some of the hospitals. CMS, on their website, cms.gov, has a listing of the accountable care organizations. You can market to them or call them up and ask them, can you have a moment of their time? Because most of them now are looking for home health partners. If they're not starting their own, they definitely need providers. But the other thing you can do, even if they have their own, you can act as a backup, which CMS encourages. So I would say go to the CMS website, look to see where those ACOs are in your community, and contact them directly to see if they're looking to do some initiatives with home health providers.
Perfect. Yeah, that seemed clear to me as a layman. So the next question is what types of challenges do you find when your care partners are not interoperable?
Usually the problem is the providers are operating on older systems. And a lot of, like I was saying in the presentation, even some of the vendors have gone out of business, but the providers are still using their software. So sometimes there has to be some tweaking. Now, if you get with some organizations can update systems for the provider, but if not, you need to ask those questions up front, like what system are you using? Is it something where we can share data? Is it HIPAA compliant? And you want to ask that of any vendor you're using, and you want to ask that of any care partner you're looking to work with. If it's somebody in the ACO, if it's somebody, even if it's in a community doctor's office or whatever, if you're receiving referrals from there, you need to ask those questions up front.
Gotcha. Okay, and I guess it's a bit of a connected question, is what types of metrics should I be measuring in my care transitions program?
Well, definitely you want to look at the client outcomes. One of the big things, and this is true for, if you look at, I don't know how many providers might be looking to do like certificate of needs in different states and that type of thing, but if you look at what insurance providers and that type of thing are looking for, they really want to know that there's some kind of utilization tracking. Like, is this patient getting the same home health services, so much so that it looks like we're spending a lot of money here where we shouldn't be? So your utilization review process is one area where you really should focus when you're using these programs, and you should have someone who's assigned to that duty, because it does affect how your referrals are coming in. A lot of providers don't realize, physicians and care managers look at that, like how much utilization is going on there. Are they utilizing certain type of care? Gotcha.
And so do you have time for we've got time for a few more questions here. So I'm just going to respond to a gentleman who asked a question regarding Ankota. And I think what I'm going to do, just so you know, sir, is that I'm going to refer you to one of my associates after the webinar, just because it's more product-based than it is sort of topic-based. But I do appreciate your question, and I'll have someone get back to you for sure. So then we have another question, which is, can you provide, and are there references of the evidence, in regards to evidence-based care transitions that we can have access to? So I guess they're wondering, based on the fact that the webinar presentation is evidence-based care transitions, are there references to the evidence that we can have access to?
I can tell you where you can get some of them, but I'm not sure if people would appreciate me doing that. You can, if you go to some of the local health departments and that type in your area, they have data that's available to you where you can look and see what people are using and how their outcomes are. I guess it's state planning departments who deal with the health provider and expansion of healthcare in your areas, they would have that information. You just simply have to request it. It is a lot of it's under freedom of information. But the other thing is, I always encourage providers to have power partners in the community. If you have other providers who work as backup for you, or you do backup for them, or people who you network with, you can ask them directly, hey, have you guys, what type of technology are you using? How's it working for you? And that type of thing. That's a good gauge. But also some of the companies, definitely Ankota, will let you know how their system is working, because we all keep statistics. We love data. So you can ask them if they're seeing differences, but for your money, the best thing to do is go to the providers in your area who you know and just say, hey, how's that working out for you? Word of mouth is always powerful, because what we all want to see is that the patients are actually benefiting from these programs. And they do work. They work with budgets. They're very, I want to say, if you understand the term disruptive, meaning they ensure that the right care to the right individual at the right time is being given, but they're reducing healthcare costs. That's why I believe so strongly in home health, adopting and rigorously adopting, because like I said, we're a little late to the party, adopting these technologies to be useful and to ensure that you're able to get those referrals, because it's one of the things that that other providers look at.
Gotcha. So then there's a few more questions, and then I have a couple of questions for you as well. So the next question is, can a COC model work with other disciplines such as OT and PT?
It definitely can. I mean, it's adaptable. There's a couple of organizations who are using that model, who have asked for that model to be put with certain populations, population health. So it's able to be used with different things, that PT, OT, speech therapy, certainly, respiratory therapy. It works as long as everybody in that environment makes the commitment to coordinate the care of that individual.
Gotcha. All right, so I have a question for you. Two questions which are less technical, I think, but I'm the less technical person here, so I'm okay with that. So my first question is oftentimes our listeners will ask later for the presentation deck. So I was wondering, are you amenable to offering the presentation you just did, to them so they can reference it later in case they weren't recording as we were going?
Sure, yeah. Gotcha. I can actually make it available to Ankota, so if they want to contact you guys too, they can.
Oh, perfect. Yeah, we're definitely going to send up a follow-up email with a little bit more information about you and everything like that. So that's perfect. And then the other question I have is a little more esoteric, but it's simply this: is that if you're whether you're just starting out, or if you are in the space already and trying to branch out into the care transition space, where would you suggest people start for looking for materials in terms of like a roadmap or good blog? I mean, obviously, I'm partial to the Ankota blog. I think that we do a great job with it, Ken Accardi in particular. But the long story short is that if you could recommend maybe a few sites or a few articles, even maybe a couple of yours that you thought might be useful for people who can sort of increase their base of knowledge, are there a few that come to mind?
Yes, the Savvy Provider, now it is mine, but I love it because how it works is I take discussions that I have with professionals and with actual providers, and I put it into a blog where it's useful information, and sometimes I'll put like policies that are useful in their practice and that type of thing on the site. And definitely, like I said, Ankota's blog I love. I do comment on that quite often. The Examiner has, in the different states, has healthcare blogs. You got to be careful. If you're a provider, you have to look for those ones that are provider-based. And then definitely, I always say look at some of the groups regarding care transitions on YouTube and LinkedIn, and you can always get great information there, and some of them will link you to a blog.
Gotcha. And then I guess we have
Or
one
staffing
last. Oh,
providers and
sorry. I'm
updates.
sorry. Did I interrupt? My
No,
apologies.
that's okay.
Gotcha. So I guess we have one more question that's come in, and I think this was touched on a little bit, but I just want to ask it since I want to make sure everything's covered. And the question is this: what happens if a provider's current system is not compatible with the one you adopt?
Yeah, I think we touched on that briefly. If you have already adopted a system and then you find out it doesn't work, that either, again, a lot of times it comes into play if somebody's got a really old system. But nowadays, most systems they're trying to update themselves to be interoperable with other systems and that type of thing. But if it's not, might need to either tweak your system or ask the provider if they're thinking about upgrading to another system, or to find a better way to share that data. The bottom line is if it gives you real-time results and it's HIPAA compliant, you can get it done. But it's just better to be able to share that information electronically and mobily. But if it doesn't work, it doesn't work. You can't make a provider change the system, but you can always ask.
Gotcha. And would you say that there, and again, you touched on this a little bit, but is there one piece of advice you could offer, sort of in your travels, to sort of make the process simpler, or is it just too complicated questions for me to ask?
No. The greatest advice I could give was don't wait. So often providers, like, I can't. Sometimes I find it hard to believe when I go to providers and they're still kind of doing things on old systems or still doing things by paper and that type of thing, and they're wondering why they're not getting the referrals, or they're not able to be attractive to referral sources. And it's like, you have to be able to function in this system the way it is now with all the healthcare exchanges and stuff. You have to have technology in place. So the first thing to do is you need to sit down, because a lot of providers, it's like, well, we don't know what that technology is and we don't know how it works and that type of. Sit down and do some research. Like I said, hire a consultant and say, explain to us what this care transition is, how it can work in our agency, and how it can benefit us. So that's the first thing, making the decision that you want to use technology and incorporate it or adopt it into your entity. That's the first thing. And then to do your homework and the research and learning the model that you want to use. But that's my greatest advice. Stop saying we're going to get to it next year or we're going to eventually adopt some technologies. The time to do it is now, while healthcare is emerging. And when all these entities are putting these different technologies in place, even the states with the Medicaids and that type of stuff, if you're a person who bills through those entities, you can't sit around and still be doing things on paper and basic computer modes. You have to be able to work with them.
Gotcha. Well, that's great. Yeah, I always say that I'm a layman. Obviously, I have some experience in the field at working in marketing, but I'm definitely not there on the front lines. And I'm always impressed by our speakers and you in particular about taking these concepts that I think are difficult even for people who are dealing with it day to day, and
Right.
making them simple enough so there's like a step-by-step process of what needs to get done and how to do it and who to talk to. So I, for one, really appreciate you taking the time, and I'm certain that our viewers did, our listeners did. So thanks again. Before we sign off, are there any other things you'd like to mention or touch on, or anything that I've missed that you want to, talk about? Because we do have a couple, a little bit more time if you're interested.
Oh, no, I just wanted to kind of thank you, Jeremy, for talking me through this particular webinar. This is really great, and I love this platform for working with providers. As you know, I'm all over the United States of providers everywhere, and I don't get to reach out to a lot of providers in this way. So it's a good thing, and I think it's a great thing that Ankota is doing. So thank you to you, and definitely thank you to Ankota, and I would certainly hope more providers, like I said, look into care transitions as a way to generate revenues and to improve patient care coordination.
Well, I couldn't say it better myself, and that's kind of why. That's why you're the presenter and I'm the facilitator. So once again, thank you, and thank you all for all the viewers and listeners for coming in and offering questions. We really do appreciate it. We're here next month, as we are every month. And so once again, thank you, Shereese, for taking the time, and thank you all. Until next time, this is Jeremy Hamill from Ankota signing off.